There you are.
All right. Hello, can you hear me?
Yes, I can hear you.
All right. Hello, everyone. Welcome to the first of the Trans Health Access Team Goes Live series. June, as some of you may know, is Pride Month. And because of that, we are going to do a series of 4 videos, 4 live streams available on our Thundermist Facebook page, along with our Thunderwell Facebook page, and our Thundermist YouTube. If you have any questions at any time, please feel free to leave them below and we will get to answer them. But above all, welcome to the very first video in our series. This first one is called Meet the Trans Health Access Team series. And that, of course, is all of our beautiful faces. You actually can't see some of those beautiful faces just yet, but you shortly will. All right, so my name is V. I use she and her pronouns, and I am the Trans Health Empowerment Specialist here at Thundermist. I work on a number of issues related to trans health policy, and I've been here for a couple months now, and it's been a great opportunity. I'm going to hand it over to the director of our Trans Health Access team and trans programming at Thundermist, Jay Watts.
Hi, everyone. Thanks, V. So my name is Jay Watts. I am the director of our Trans Health program. I'm a licensed clinical social worker. I have been at Thundermist for just over 5 years now. I joined Thundermist specifically to start this program. And so when I look at what the Trans Health program has been, I think it's helpful to know the program started with just me doing a lot of the different roles that we see here, with many fewer clients than what we serve now. We're currently serving over 1,000 people within our program, and it continues to grow every month. My focus, my goal around this Trans Health program, and with the folks that you're going to meet here today, the members of our team who are so incredible, and we couldn't do this work without all of their incredible talents that they bring to us and to the community, is that I've always just wanted to create a program that would allow people to access services and to affirm their gender in ways to make it easier than it was when I came out and when I transitioned. And so looking back 15 years ago, these things didn't exist. I couldn't find a doctor, had to go really far away to be able to get care. And it was really, really difficult to navigate those things. So my focus has always been, how do we just make this easier for people? And creating the program that I wish that I had when I was in my 20s and came out and had no idea how to find or access any of these things. So thank you very much. And I'm really excited to introduce you to all of our team members today.
All right. Perfect. Thank you, Jay. And now I'm going to introduce you to the rest of the Trans Health Access team. For those who may not be familiar, the Trans Health Access team, or that, pretty clever, is a group of medical providers, behavioral health providers, and support staff who provide care for Thundermist's trans and gender diverse patient population. And there are quite a few of us. So now we're going to meet the entire team. Feel free to introduce yourselves, describe what you do here at Thundermist, how long you've been here, and anything else you think patients should know about you. All right.
We're on the air.
Oh, so my name is Darnell Nashbire. My pronouns are him. I am a trans health access team clinician. So I provide counseling and therapy to trans patients on a part-time basis at Thundermist. I've been here for about a little over a year, I would say. I enjoy this work that I do. I am a BRIC alumni with experience in trauma-focused cognitive behavioral therapy, motivational interviewing, family intensive therapy, psychodynamic and analytic, and various other forms of therapy. I really enjoy the work that I do here, and it's nice to meet you all.
My name is Logan England. I'm one of the Trans Health peer navigators here at Thundermist. I'm the pediatric peer navigator. I usually work with our 18 and under clientele. I've been here for 2.5 years. I'm also studying social work at Rhode Island College. In addition, this is my cat, Catherine. She's happy to meet you. So what we do as the peer navigators is we work with, it's called psychosocial care coordination, which is just a really fancy way to say we try to help our clients with their needs out in the community. We help connect people with the resources to get their name and gender marker changes done, navigating them through the legal process. We help empower and educate our clients around working with their insurance companies to advocate for getting approvals and appeals for different procedures or what have you that they need. We support people their families, their schools, their employers about their needs as trans people. And I told Jay at my interview I would take this job even if it was a volunteer position. I thought it was such important work, and I'm grateful that I still get to feel that way today.
Hi, my name is Tony Grace, and along with Logan, I'm a peer navigator for the trans community at Thundermist. I normally work out of the West Warwick office or Woonsocket. I'm a trans woman myself. My pronouns are she and her. For me, it's a dream job. I get to meet some of the most wonderful people that you can imagine at Thundermist. So basically what we try to do as peer navigators, we try to knock down some of the barriers or help navigate some of the barriers that trans people run into, whether it be with name changes, social security, license, the whole gamut. We've been through a lot of that same stuff in our personal lives. So we kind of, instead of reinventing the wheel, we could probably help a lot of folks get through that. It's a pleasure to be here, and thank you.
Oh, hi.
Not everyone got to. I don't think everyone got to be introduced, right? We're a little.
Yeah, can we
Hello, everyone. We have a couple more team members to meet first. Yeah.
bring Andrew, Ali back on? And who else am I missing? Ali, Andrew, and you. Perfect. Hi.
Go ahead, Ali.
I'm Allie. I am one of the therapists in the program. I work mostly out of West Warwick and down in South County 1 day a week. I have been doing therapy for about 12 years now, mostly focused on trauma and also working with the queer population in various forms. I've been at Thundermist now for about a year, and I've had a chance to meet some really great colleagues and some really great patients. So I'm very happy, and I think this is a really great program.
I'm Andrew Lewandowski. I am also a behavioral health clinician at Thundermist in the trans health team. I'm a licensed clinical social worker. I have been at Thundermist about 2 years. I graduated from Ohio State initially. I'm from Ohio and moved here 2 years ago to take the position at Thundermist. Yes, the Ohio State University. Thank you, Mina. So Before I was here, I worked at the VA for 4 years, and so I have some experience doing community healthcare and working with folks experiencing addiction and severe and persistent mental illness, in addition to trans folks. I use a lot of DBT-oriented or informed interventions in my practice, as well as motivational interviewing and CBT. And I, like Jay, I've also been in the community for a while. I remember when there weren't many resources, so I think this is a really great program, and I'm really glad that we're able to offer it to folks. I've met some great colleagues through it, and really enjoy my work with my patients. So, thank you.
Mina.
We can't hear you.
Just kidding. Hello. Hi, I'm Mina. If you're watching this, whether now or later, you have maybe seen my face before because I posted it on our Thunderwell page a few times. I am the trans and LGBTQ wellness lead for Thundermist. I have been here almost a year, actually, which is kind of crazy. And yeah, I oversee all of our wellness programming. Sadly, a lot of that has been put on hold because of coronavirus, but we've been trying via the Thunderwell page and some other resources to have things just like this great little series here and to move as many of our events online as possible. So thanks for being here if you're watching now or in the future.
All right, perfect. And you spoke about the Thunderwell page, Mina. Would you like to explain what the Thunderwell page is and what the wellness program at Thundermist does?
Yes, for sure. Wow, I don't remember the last time I was interviewed. This is exciting. So mainly our goal when it comes to wellness for Thundermist is we try to put on as many events as possible, focusing on reducing social isolation, helping people make connections in the community. Our population of, trans folks is definitely more isolated than, the average population. And it can be really hard when you're sort of trying to figure out who you are and figure out your gender and like find places that you're accepted to meet other people like yourself and to make friends and such. So we try to help with that as much as we can. So what we usually have is we do things like fitness, yoga, swimming. Unfortunately, some of these have been put on hold because of the virus. And then we also have game nights. In the past, we've done movie nights, bowling, all kinds of things. And I'm really hoping that we will be able to get back to those things, in a few months. But in the meantime, we have transitioned as much of our programming as possible over to the Thunderwell page. So that is Thunderwell. If you haven't liked that page already, please go do so. It is where we put all of our events and things, and also like other relevant announcements. Occasionally, I haven't been doing this as much as I would like to, but I would like to continue to share cute videos of animals, those kinds of things. So right now we have, we're actually, one of the slight, silver linings is while we haven't been able to do our fitness class in person, because it's moved online, we actually now get to have it every single week, where it used to be only a couple times a month. So every Monday at 6 p.m., our wonderful trainer, Alex Weaver of Alien Athletes, leads from 6 to 7 p.m. a movement class that is for all levels, open to anyone. It's weight and size neutral and inclusive. It's a great class. We've been getting a lot of great feedback on that. And then twice a month, the second and fourth Wednesday of every month, our wonderful yoga instructor, Mimi Budnick, has also been doing her yoga classes virtually. These are all live streamed on the Thunderwell page. And we're working to make sure that beyond Facebook, using this StreamYard technology, we can also put that on our YouTube and Instagram and some other places. And then every week we also have game night, which is tonight actually. So every Thursday from 6:30 p.m. to about 8:30 p.m. We have folks hop on to a Zoom link that I post, and we play a variety of Jackbox games. It has been really fun. We've been getting new people every week, and honestly, I really am really pleased with how well that's been going. We've all had a lot of fun, and we're having another new person, I think, join us tonight. So if you want to hang out with us and play some games tonight or next week at the same time, please come on over to the Thunderworld page and join our Zoom. It's been a really good time.
All right, one follow-up question, Mina. You talked about all these great events that you're putting on, and I know that in order to achieve health and wellness for a lot of trans and gender diverse people, it requires tackling social isolation. I know that for my own self as a trans person, I often have difficulty figuring out how do I find a community. And once I can be with a community, I do feel the benefits of having that kind of need met. So what would you say to someone who wants to go to a trans wellness event, but is a bit nervous about it?
I'm really glad you asked that question because, yeah, I mean, that's the what I tell everyone. They're like, oh, like, I don't know, like, I'm worried, and because like being trans is awkward, and I feel like I'm kind of awkward, and I'm like, that's the whole point. We're all trans and we're all awkward, and it's very fine and it's very comfortable. So I totally get being nervous. If you want to attend something and you're unsure, please feel free to message me on Facebook, or also, I mean, if you look through some of the old posts, my cell number is plastered all over the internet at this point. So I really always encourage people to reach out to me directly. And I've had people do that in the past where like, I will just talk to you one-on-one a little bit beforehand, and then we can some people like kind of work their way up. Like we'll talk about going, and then, in a few weeks, if they're in a right headspace, they'll join us. And I think it's the same way online. So if you want to try joining game night or any of the other events, or have ideas for events you'd like to see, please don't hesitate to message me on Facebook, or I'll also drop my number and email in the comments. And everybody is really nice. It's very low key. And I myself am an extremely anxious person, and I promise there's nothing to worry about and no need to be nervous. And but that's totally normal. And we have all felt that. And a lot of us still feel that way. So thank you for asking that question.
All right. Thank you so much, Mina. It's great to hear about the work that you do. And coming up, we're going to hear from Tony and Logan, who are our trans health peer navigators. For myself as a trans person, and generally as an LGBTQ person, it's pretty scary to go into a doctor's office and say, I need care, I need help. But luckily here at Thundermist, we have two wonderful peer navigators who help our patients along every step of the way, mostly every step of the way, Tony and Logan. Now, Logan, I'd love to begin with one question for you.
Sure.
You've been in this position for a while now, and I would love to hear you describe what is the impact of having a peer navigator help you navigate trans healthcare?
I think that it has a couple of different aspects. I think that like you were saying in your conversation with Mina, a lot of trans people suffer from some level of anxiety, and working with strangers to go to court for your name change, or to the concept of having to go to the DMV and then stand there in front of everybody and say, I need my gender marker changed. Those can be overwhelming for people, not to mention those are very crowded, loud environments that can create anxiety in everyone. So I think having the support of being able to talk with a peer navigator, to go into those situations knowing that you have gone over the checklist and have all of the documents that you need prepared, that you are totally set for what this experience is going to be like. And for some people, even bringing us with you to those events creates, it removes some of those barriers for people. In addition, I think that unfortunately, our healthcare environment sometimes creates a situation where, unless you know specifically what you have a right to ask for, insurance companies don't always give you what you need. And being able to empower people to know what those are and to help them write those letters and advocate for themselves, I think has given people access to some healthcare they would not necessarily get. We can accompany people to appointments for either at Thundermist to help you kind of bridge that gap to talking to your provider, to outside providers, to for surgery consults or preparation. And so people who would avoid those types of things and that know that that we have their back.
That's amazing to know. And I feel comforted knowing that you have their backs too. Um, as a new addition to the Trans Health Access team, I'm really pleased to say that Tony is a wonderful addition. Tony, you've actually been at Thundermist before your position at as a peer navigator. I think a lot of people might assume that a program that focuses on trans health, would only have trans people working in that program. But that's not true. There are trans people working all over Thundermist, and I would love to hear from you. What do you think, what does it mean to another trans patient to see another trans person working in healthcare?
Okay, so when I was hired by Thundermist, it was about 2 years ago. I was hired as a patient service rep, a receptionist, in the West Warwick office. And I was the only trans person in reception, which turned out for me to be a wonderful experience because we do have so many trans patients who come and go from our facility, and I got to meet them all and build a rapport with a lot of people. So yeah, we have transgender people who are RNs, who are medical assistants working at Thundermist, aside from our team. And I can honestly say with this program, when I first came out and tried to get things done in my own life, like my license change, my name change, and all that, I could have used some guidance because it's pretty difficult to navigate this stuff by yourself when you're first looking at it. It can seem overwhelming. And a lot of the people, the patients I've been dealing with, are looking for just how to get started. How do you go do a name change? Which order do you do these things first? Do you do your license or your social security? Where do you look in your medical policy to find out if your surgeries are covered or hormone treatments? And all the options that are open, I think you might be surprised at all the different ways you can go with your transition at your own speed. And that's what we're here for, to help you with that. And so you don't have to reinvent the wheel and go through a lot of what other people have, in that struggle.
And with the current COVID pandemic, we know that I'm still trans and you all are still trans, and things don't necessarily get easier during a pandemic. Can patients still reach out to both of you as peer navigators during this time?
Absolutely. So if you look behind me, that's the wall of my office in my house. We've been working from home for quite a few weeks now, and it's worked out quite well. So a lot of our contacts are by phone. Whether you're a Thunderbird patient or not, or you're interested in getting information, you can always reach us through Thundermist, request to speak to a peer navigator, and we'll call you back and help you with whatever we can. So you can certainly reach out. Hopefully we're going to be back in our offices before too long, but we don't know when. But we're still here, and we're still, as he said, we're still trans. We're still doing our job. So feel free. We're here for you. And please don't ever be shy. I think that's the most important thing to get past. Don't ever feel hesitant about reaching out to one of us. We're the line workers. We were all where you're at. Some of us are still there. And transition is lifelong as far as I'm concerned. So we can all use the help.
Absolutely. We're both still working full time. We are also, both of us still working from home, but we are working. You can also text both of us. The phone numbers that you have for Tony and I are our work cells. So if you have phone anxiety, it's fine to text us. We do try to reach out to everyone to do a welcome call when we have new patients, just to kind of, give them information about the program. You might have talked to, a lot of us might have talked to us once and then not again. But we are very fortunate to be in a position where we have access to a lot of resources. So even things that we can't specifically help you with, we can either help you get the resources to tell you where to get that help, or we will keep working at it until we do. So if you think you need some additional support on something, even if you think that might not be what we do, call us anyway, and we'll get you connected to what you need.
I truly wish that I had people like you when I first began navigating the healthcare system, because it's very much intimidating. I know that, Tony, you were talking about being a patient service representative, and how literally when you go into Thundermist, you are the first person that patients can see. And to know that equity and diversity and inclusion don't just have to be these broad statements. And it doesn't just have to be limited to seeing the patient, in an appointment. It really begins at the front door. And with a lot of what you're doing, it even extends far out of the health center, such as like going to the DMV and wherever, you might end up. So I'm going to ask you both one more question. When you work with our patients, what is the most common anxiety that you see, and how do you help them squash that anxiety?
I have to say, right now, in the present time, the biggest anxiety is COVID related, and some of the ties with just normal life that seem to have been cut. Keeping in touch with other people. A lot of the state offices are closed, and so the access is getting a little bit limited. But this is a good time to start planning. This is a good time to talk to a peer navigator and say, okay, so when this stuff gets back rolling, where do I go? What do I do? What forms do I need? This is your planning time, so it doesn't have to be wasted time, even though we're limited in going out because of our COVID restrictions. So we can still get you going and point you in the right direction. And there are things that you can do now to start working on with your transition. The doctor's appointments, we do virtual visits for new trans patients and for established patients. So that's something to get started if you'd like, as well as behavioral health appointments. And we can help you set those up if that's something you're interested in.
Yeah, I think a lot of times people they're not sure what to expect. They're worried they're possibly going to get misgendered. They're going to get dead named. They have in other places. And when we say that we're trans competent, they don't really know what level of care they can expect from that. And so when we do those outreach calls, when they call in for the first time to the call center and they're asked for their preferred name and which pronouns they use, and we, ask the right questions, I hope that we help set them at ease. And then when they know that their questions are welcomed, that we're not trying to gatekeep people's gender identity at any point in the healthcare process at Thundermist, and that we're there for them, that sets them at ease, that the bar for what can be trans competent healthcare can be quite high, and that they can expect better from their care providers.
Absolutely. And I think everyone deserves better from our healthcare providers. Tony, Logan, I want to thank you both so much for spending time with us this afternoon. And by us, I mean like me. I'm glad to see your gorgeous faces. And coming up, we're going to meet our behavioral clinicians who work with the Trans Health Access team. I'm going to be summoning up Allie, Darnell, and Jay. Hello.
Hello.
All right. So it's amazing to know that there are trans behavioral health clinicians out there in Rhode Island. I had such a hard time trying to find a therapist, and I had to pull teeth, walk over Mordor. I don't know what Lord of the Rings says. I had to do so many things in order to find someone who would look at me and say, I see you for who you are. And, that's a very simple baseline to begin at. But luckily, with all of you, I'm happy that you can facilitate that for our patients. I would love to begin with Allie. Allie, in your position working with patients throughout Rhode Island, you mentioned that you even do a day at South County. What is a common anxiety that families might have when they have younger trans patients coming in?
I think probably the biggest concern I see is, they're a kid who they really know. Kids are always changing their minds. Kids are figuring out who they are still. So I get a lot of families just very scared that they're making a decision that they they don't really have an answer for yet. Which for parents is very scary. I mean, that's their kid. They want the best for them. I think we have a really amazing team at Thundermist who's really able to work with both the family and the child on addressing some of those fears and on helping them to move at a pace that is going to be healthy for the child, who generally by that point is they're ready to move forward. They know, and it's, you know, it can be harmful to them to not be able to take those steps, but also with the family to be able to make sure that they're feeling supported in all of this and to try to, you know, ease some of those fears. And that way they're able to be more present for their child who needs their support during that time. So we have some really amazing people who can kind of tackle that on all fronts and try to make sure everyone's getting the best care that they need.
That's really crucial. And I think a lot of people can assume that there's some special training that you need to work with trans patients. And Andrew, I know that you carry a lot of experience beyond just caring for trans patients. So how did you learn to care for trans patients, and what experiences do you bring that help you be effective?
Well, I mean, I think part of working with trans folks involves understanding that you know a lot of us have been through a lot. You know, I think being a trauma-informed clinician has primarily been the thing I've leaned on and drawn on the most. And you know, especially in the work I've done at Thundermist. You know, I think a lot of trans folks, you know, aren't used to being told that they're the expert on themselves or their identities. And I mean, I think that's really important as clinicians to understand for anybody, but particularly for, you know, folks in our community that, you know, people are who they tell you they are, you know, and that's really all there is to it. You know, and I try to just, you know, really encourage people to trust their own judgment. You know, I think all of us have developed a lot of skills and strengths that have gotten us through the things we've been through. And, you know, I try to help people get in touch with those skills and strengths. And that's been, you know, a lot of what I've learned in my past experience that I've carried with me into this role. And I think my understanding of like how to do that has really just developed and increased over the time I've been at Thundermist. So.
Wonderful to hear. Darnell, I'm going to ask you a question now. Hi, Darnell.
Hi.
Hi. So I'm normally based in West Warwick, and I live in South County. You're based in Woonsocket.
I am.
Normally, truthfully, I've never seen you in real life. You might be a hologram. I don't know. But knowing that, I would love to hear from you. What do you think is important for other healthcare providers to know about the patients that you serve?
For other healthcare providers, I would feel like it's important to know that these patients are just that, people who are patients. They may identify as trans or identify on the gender spectrum, but they're patients with problems, just like other people. I feel like there's specific ways to treat, you know, some of the things that they present with. So some education on that would be helpful. My approach as a provider is to acknowledge my cisgender in the room so that patients it's not like an elephant in the room. So that's really helpful for me as a provider. I think, you know, using the skills that you have and bringing them forward to address the patients is the best you can do, but understanding that they're people at first hand and going from there.
You need a lot of patience to help patients and
Yes.
realize that these patients are people fundamentally. Ultimately, I think a lot of people can get frozen up with, well, what do I do? What's the right language? And ultimately, how do you want to treat any other person? Thank you, Darnell. Jay, I'm going to ask you a question. Hello.
Hi.
All right. So you have you were responsible for setting up the trans health program here at Thundermist, but your experience extends far beyond that. you didn't just pop out trans 5 years ago and you're like, I'm going to do this at Thundermist. You have a tremendous experience working with community members. I would love to hear from you. What do you think makes Rhode Island's trans community? Let me rephrase this. What specific care do you think Rhode Island's trans population needs? What have you identified over the past few years? How has it changed?
So much has changed. If we look at kind of where things have come from, not being able to find a provider, the lead up right before we started this program was having some local providers who left the area and having this a bottleneck of there were a couple people who were seeing patients, but in order to get in that door, it was very Rhode Island. Like you needed to know someone who knew someone who like had the secret password, which was like, please see me, I'm trans. But no one knew that. It wasn't on a website. You had to get connections. And I was so frustrated that that kept happening and worked with TGI Network and there was a trans health coalition that was created for a little bit to look at some policy and action around moving some of these things. And then ultimately working with Lauren Nocera and saying that, this program, we just need to figure out how to do it. And, I'm so proud that that is sort of where things landed and we were able to kind of build from there. And the very first thing that we fought for was health insurance. So when the program started, it was the year before Medicaid started covering trans-affirming care in the state. So that was our big fight in the beginning, was trying to get people the care they needed while the health insurance was still allowed to have exclusions saying they wouldn't cover their care. And then as that eased up, being involved in the process, the learning process that I think we've all gone through, both in helping people in the community advocate for themselves around what healthcare they should be able to access, and also helping the insurance providers to understand what care they need to be providing to us. And some of those fights have gotten easier because we've had them repeatedly, and then changes get made, and versus it being a one-off change and actually making system changes to allow those things to move easier. As far as where I think that things are going, if we look at stuff that we still need, we need to be covering electrolysis. Like folks need to have better access to hair removal. That is not currently covered. Sometimes it's fuzzy. It takes a lot of work. Folks who have done this know they may be fighting to get reimbursed for long periods of time. Wanting that to be more accessible, and not just for surgery prep, but people need to be able to access hair removal, like facial hair removal, body hair removal, when we know that those things are fundamental to the safety and well-being and mental health of our patients, that of like just feeling comfortable in themselves, feeling comfortable in the community. And it's not a cosmetic feature, it's a medical necessity. And getting that, I see as one of the next big frontiers that we're starting to make some progress on to increase that access. In general, for Rhode Island, I think that we've been in a pretty good spot. Like I moved to Rhode Island and started working here in 2004, like right at the time that I came out, because Rhode Island at that time was only one of 2 states in the country that had protections for people who were trans in employment. And that was significant. So like that, was back in, so it was 2004. And at that point, the law was 3 years old. It's now been, we've had that law on the books for 19 years. Many, many, many states have it now. And, but Rhode Island has always been on the forefront of making positive changes with folks in the community. And I'm really proud of the work that I've done in being a part of advocating for those changes.
Amazing to hear all of what you've done. I truly believe that when you can begin having healthy lives, it changes everything. And oftentimes it begins with the people that you come face to face with. As behavioral health clinicians, previously you have been face to face with a lot of our patients. Maybe you're on the phone now. But I would love to hear from you. What are some common anxieties that you hear trans patients have, and how do you help them work through that?
I mean, so I'll start. As far as seeing just the very beginning, right? There are times when, as a trans clinician in a room, I've been the first face-to-face trans person that someone has talked to, right? And I know that others in the room have had that experience, and there's how significant that is. Whether it's me, whether it's the peer navigators, whether it's like clinician, just those face-to-face interactions, and some of it is just then this relief. There's just immense amount of relief, of pressure, of talking about this for the first time and having someone be there to listen and affirm and be 100% in it with them, and helping people understand that overwhelming feeling, kind of surreal, I can't believe this is happening, and feeling all those things at once is completely normal. Completely normal. And again, there's no one, everybody takes this at their own pace. There's no one way to do this, and reassuring people that the way they're doing it is the way they need to be doing it, and that we're there to help them to move through their journey in life, and try to help guide them along the way where we can, and witness that alongside them.
And living a full and healthy life is indeed a journey that has ups and downs. As much as I'd love to think that there's the perfect way to give care, I don't think that's always the case. I would love to know, when you give care to our trans and gender diverse patients, what do you feel like is something that is effective in communicating with them? What works when you give them care, and what doesn't work so well?
I think one of the things that is really important in working with the community is understanding the ways in which trans folks in general, we are less likely to have equal access to employment. We're less likely to have equal access to the same amounts of money or resources or income other people have. And I think when you combine having a trans identity with other identities, being from a working class background, being a person of color, having past trauma, having sexual trauma, various things, all those things sort of work together, and I think really impact a person. And I think I try to bring that into the room and kind of honor it, and acknowledge to the person, the fact that you're trans, and the fact that you have all these other identities, the fact that you have these other things going on, that's all important, and it's all interconnected. And how do we work with all of that together? And I think that's really important. I think adopting an intersectional approach is pretty integral when you're working with trans folks in particular.
Thank you. Oh.
Just to add to what Andrew was saying, I think, there's multi-layered issues that trans patients come to session with. And I think for me, what works and what's effective is to meet them where they are. When they come in, I don't have an agenda for them. This is their session. They take it by the reins, and I am there to support and encourage and kind of guide them in whichever direction they're looking to go.
It's really crucial to meet patients where they're at, and where we're at right now is we need to wrap up. We have a few minutes left, and I want to pose one last question to all of you. As we kind of established, it can be anxiety inducing to say, I want to receive care. And knowing that, I would love for you all to answer, what is one thing you would want any prospective trans patient to know before they come see you? What would you tell anyone who's a bit nervous or on the fence? What would you say to say, you belong here, you belong here? Ali, I'm going to start off with you.
I guess actually building off a lot of what was just said, is that there's no right or wrong way to be trans. There's no one person that's coming in with the exact same story as everyone else. So not everyone's going to have the same journey. Not everyone's going to have the same endpoint. Some people might not have an endpoint. I guess one thing I do want to mention is, sometimes for non-binary folks, they might feel nervous about coming into care, concerns about not being trans enough or not knowing if they're going to find someone who is comfortable letting them be wherever they fall and not pushing a binary on them. So I think something to know is that we are very, inclusive across the broad spectrum of what a trans identity might mean. And we will certainly meet people wherever they are. We will write letters with the honorific that you choose. There's plenty of ways that we can really affirm folks, and we try to do that to the best of our ability.
Thanks, Allie. Andrew, what are your thoughts on what prospective patients should know?
I think one thing I try to be, I try not to always share a lot about myself in session because it's the patient session and I want it to be focused on the patient. But, I do try to be pretty transparent about the fact, given that I occupy a dual role as being trans and also being a clinician, that, I've been in the same place that a lot of my patients are now. I like people to know that recovery works, recovery is possible. This is really, really hard work, but my goal as a therapist is to be an ally to the person and getting, doing what they want to do. That's something I really try to help my patients understand.
All right. Jay, do you have thoughts on what prospective patients should know?
I would say just make the call. What I hear is folks will sit and I'm going to make the call today. I'm going to make the call today. The next day say, I'm going to do this. And then the next thing you know, months have gone by and you've been saying, I need to make this phone call and start this process. The scariest thing that you're going to do is walking through that door for the first time. But then once people do that and walk through the door, I often hear our patients describe our health centers as feeling like a sense of safety when they walk in the building, that there's going to be people there who will stand up for them, that once you get into our space, that we are, and like space is our virtual space, but that you're not alone in this process. But the thing that we can't do for you is having you engage in that process with us. So we just need you to take that first step, and then we can meet you there and take you along the way.
And Darnell, what thoughts do you have?
What I would say to prospective patients is that you are safe here. This is a safe space for you, where you have support, a multitude of providers, a team of supports to get you to that better quality of life that you're looking for and to affirm you at however you desire.
We're also going to hear from our peer navigators, Tony and Logan.
Hi. So in closing, I just want to reiterate basically what everyone else said, which is don't put off the call. It doesn't cost anything. And you're going to be talking to somebody who can truly empathize, who's been there. That we all have individual journeys, but we also have a lot of commonalities. We go through a lot of the same things, and it's helpful to have someone to talk to. COVID-19 or not, we're still there. I wish you all the best.
All right, thank you, Tony. And Logan, do you have any final thoughts? I believe you're muted.
I believe you're right. I was muted. So if people have financial concerns about coming in for care, I wanted to let them know that we do have social services that can help you sign up for a variety of insurance programs. And we also work on a sliding scale. So if money is a concern for yours, please give us a call and let's see what we can do to help you remove any of those barriers. If the biggest concern that you're having We also have co-pays are waived for several of our different services at Thundermist, such as our behavioral health services for our trans health clients. So if you're call us, that's the biggest message. Give us a call and let's discuss whatever those barriers are to care, because we are here to help remove those, not to keep you out. And if you're scared to walk in the door, let us know and we'll be there waiting at the door to greet you when you come in. Okay.
That's fantastic. I want to thank everyone who's watching right now, whether you're watching it live or in the future. I hope the future is great. But more than that, I want to thank everyone here on the Trans Health Access team. If you would like to learn more, feel free to find us on the Thundermist website. Be sure to check our Facebook pages out. It's going to be Thundermist Health Center, and you can find more about our wellness events on Thunderwell. More than that, I'd love to thank Lauren Tate, who is working behind the scenes to make sure everything goes smoothly. I wish everyone the best. Happy June. Be safe, be well, and hopefully we will see you all soon. Bye.